Hello friends, I'm Dr. Sharat and I'm a pedodontist. Today I want to talk to you about the basic dental myths which a lot of patients have been talking about and thinking about, but most of which are false. The first one that I want to talk to you about is that dental treatment is costly. No, I'm sorry to burst your bubble, but dental treatment is not costly. It is negligence, your negligence, which is costly. You see, it is mandated that every patient must visit a dentist once in every 6 months. It so happens that the patient may not be able to visit the dentist so often. But every time you look in the mirror, you brush your teeth, you can notice there are some spots on your teeth or not. If there are some spots on your teeth, you can assume you need to visit a dentist as soon as possible. Because if that turns out to be caries, if that turns out to form a cavity, you should know that that treatment will take a lot of time and effort, which requires a lot of money to be spent. If you come to the dentist at the earliest, then your treatment will be limited means and very small amount of money needs to be spent. The second thing that I want to tell you about is haggling, bargaining. When you go to your office, your work, you get the money that you deserve in the form of salary, PF, DA, etc. And you don't negotiate all of that every single month when you receive your salary, right? In that case, why do you have to come to a dentist or any other doctor for that matter and haggle over their fees? I cannot pay 200, I'll pay 100. I cannot pay 1,000, I'll pay 800. What if your boss says, I cannot pay you your 15,000 salary and just give you 10k for a month? See, as that is your salary, this is ours. Please respect our profession. You are an educated person. Why are you haggling over fees? You don't haggle over buying some expensive t-shirt at an Adidas store, do you? It's the same thing here. The third thing is scaling. A lot of people believe that scaling removes the enamel layer. Well, another bubble to be bursted. Scaling does not remove your enamel layer, and there's no literature supporting that. Yes, it does happen with people who are affected with fluorosis, but for general, normal people with normal teeth, enamel layer does not move off with scaling. It is just like, imagine you taking a bath and you're scrubbing your skin. It's the dirt that comes off, not the skin. The same way, scaling removes all the stains and debris which is accumulated on your teeth. And that is what we remove, not your enamel. Finally, me being a pedodontist, I'd like to drop in a small word regarding the treatment of children's teeth. You see, children have such beautiful smiles, and a lot of parents tend to believe that anyway those teeth are going to fall. So why not just wait for them to fall? You see, it takes a long time. It takes almost 6 to 7 years for a complete permanent dentition to be out in the oral cavity. So while you think that maybe it's just one tooth which is spoiled or maybe two teeth, anyway they are going to fall off, that affects the mental and dental attitude of the child. The child forgets how to smile properly because he's teased. The child is not comfortable visiting doctors or dentists. Even after they grow up, they are scared. They don't know that certain treatments require certain time. And most importantly, when your child's teeth have cavities, each cavity harbors dangerous bacteria which cause more cavities. Even if the tooth falls off, bacteria still remains inside the mouth. Not one tooth, but many other teeth. Even the permanent teeth which start erupting will be affected, may be affected, and be involved by those bacteria. That bacteria will make sure that your teeth, your mouth is more caries prone than normal. Please understand that a child's smile is something everybody wants. Please take care of such beautiful smiles. I hope that these myths, which generally go on in the patient's mind, are now busted. Thank you.